Hello everyone, I am Dr. R.P. Sendulkumar. I am a practicing pulmonologist at Chennai Chest Center in West Tambaram. On this World Asthma Day, it is my privilege to share information on asthma. World Asthma Day was started by GINA, Global Initiative for Asthma, and is observed on the first Tuesday of every May. The theme for this year is Asthma Care for All. The majority of the burden of asthma morbidity and mortality occurs in low and middle income countries. Asthma Care for All message promotes the development and implementation of effective asthma control programs in all countries according to their resources. So let's see what is asthma. Asthma is a lung disease which affects both children and adults, both men and women. So it is a non-contagious disease, meaning it doesn't spread by cough or sneezing or by contact. It is caused by allergy. In nearly 3.7 crore people in India are asthmatic. Nearly 42% of deaths due to asthma in the world happen in India, and a very bad statistics for India. In asthma, the air passages in the lung become narrow due to allergic inflammation and tightening of the small muscles around the small airways of the lung in those individuals who carry the asthma genes. This is a response to exposure to trigger factors. So you need both the genes, asthma genes, as well as the trigger factors in the environment to cause asthma. So it is a gene environment interaction which results in asthma. So what are the symptoms? The symptoms for asthma are cough, wheeze, shortness of breath, and chest tightness. And rarely some patients can cough out blood when there is incessant continuous cough. But the most common symptom of asthma is a chronic dry cough which lasts for days, weeks, sometimes months, and the cough worsens towards the evening or night or early mornings, and the patient's sleep gets disturbed because of it. The trigger factors vary from person to person and can include dust, fumes, smoke, cold air blowing on the face, furry pets, dogs, cats, birds, strong smells such as perfumes, deodorant sprays, mosquito liquid vaporizers, house dust mite which is present in the bedspreads, and strong chemicals like bleaching powder and acids. So it varies from person to person. Sometimes the trigger factors can even be emotional, stress, anger, or some drugs. Example, drugs which we use for treating hypertension called beta blockers, or the more common drug called aspirin or painkillers. These are all can work as trigger factors. In some patients, exercise can be a trigger factor. In others, gastroesophageal reflux or acid reflux into the food pipe can act as a trigger factor. Unfortunately, asthma is often underdiagnosed and undertreated in our country. So most of the patients who present with cough either self-treat or reach a pharmacy and take some cough mixtures, and that's way we diagnose asthma quite late in our society. And asthma cannot be cured, but a good thing is good management with the latest inhaled medications controls the disease to such an extent that people with asthma lead a very normal quality of life as if they are completely cured. So, advantages of taking inhaled medication. Why not take oral medicines or tablets? There is a stigma in society with taking inhaled medications. People think that taking inhalers is addiction, but I think this is a wrong word. Inhaled medications have a lot of advantages when compared with oral medications. The most important thing is the dosage in inhaled medication is in micrograms, whereas the dosage in oral medicine is in milligrams. So it is 1,000th of the dosage that would normally take by oral medicines. And the medicine reaches the target organ, that is the lung, directly and starts acting within a few seconds, whereas with oral medicines, the medicines take a long time, half an hour or maybe 1 hour to reach the lung by circulation, and the medicine also reaches other parts of the body apart from lung where it is not intended to reach and causes a lot of adverse effects. So the advantages of using inhaler versus oral medications is very obvious, and in fact inhaled medications are so safe that we can safely prescribe inhaled medication to pregnant women with asthma and growing children with asthma. In fact, studies have shown that regular use of inhaled medication and good control of asthma in children is very beneficial and aids in their intellectual as well as physical growth. So now we have inhaler medications which are called controllers, which control the inflammation and prevent inflammation in the airways, thereby preventing long-term loss of lung function or what is called as airway remodeling from happening. So these medications are available as 12-hourly medicines, so they can be taken twice a day or even once in a day, 24-hour medicines. So it's very convenient for the patient to take them either in the morning or in the evening, and thereby you don't need to expose yourself as an asthmatic to the society by taking the inhalers in front of everyone. So you can also control the disease well, thereby you can have a good quality of life, productive life, and a very normal lifespan with asthma. So this is the message I want to give. Inhalers are very safe. Asthma can be controlled to such an extent that it's almost a cure. Starting this World Asthma Day, I'll be publishing a series of vlogs about asthma in English through my YouTube channel Chennai Chest Center. You can watch them and understand more about asthma, the treatment options that are available, and what are the preventive aspects for patients with asthma. Thank you.